Hey, so tonight we're going to talk about something a little different. Something that might make you incredibly grateful for modern medicine and the simple comforts of your couch. We're going to journey back to a time when getting sick wasn't just inconvenient. It was a terrifying gamble, a roll of the dice where the house always seemed to win. Forget antibiotics, sterile operating rooms, or even a basic understanding of germs. Our ancestors faced ailments with a mix of desperation, superstition, and practices that by today's standards sound like something out of a horror film. These weren't just ineffective. They were often the very things that sealed a patient's fate. Prepare yourself to step into a world where the cure might be worse than the disease, where the line between healing and outright harm was dangerously blurred. All right, find that cozy spot, maybe grab a warm drink, and let's dive into the truly strange medical treatments that could, and often did, kill you. You wake up with a fever, a throbbing headache that feels like a blacksmith is hammering inside your skull. Your chest aches with a dull, persistent pain that tightens with every shallow breath. Your body shivers uncontrollably, even though the air in your small, drafty room is thick and still. You've heard the whispers, seen the pallor on the faces of those who've gone before you, felt the chill of fear that precedes the arrival of the local physician, or, more likely, the barber surgeon. You're not in a hospital with gleaming white walls and the comforting hum of machines. No, you're in a bed made of rough spun linen, perhaps in a room shared with family. The air heavy with the scent of stale wood smoke, unwashed bodies, unsettling aroma of decay that seems to cling to everything in this era. The door creaks open, and in steps a figure, perhaps a man with calloused hands and a stained leather apron, carrying a small wooden box. He doesn't offer a stethoscope or a thermometer. Those are centuries away. Instead, his gaze is fixed, evaluating your flushed face, your rapid breathing, the unnatural sheen of sweat on your brow. He nods gravely, a silent pronouncement. The diagnosis, as it always seems to be, is an imbalance of the humors. Your blood, he declares, is too hot, too abundant, causing the fever, the pain, the very illness that grips you. And there's only one way, the only tried and true method passed down through generations. To restore that delicate balance, bloodletting. Imagine the scene unfolding before you, not as a historical anecdote, but as your immediate reality. The barber surgeon sets down his box, revealing an array of tools that gleam dully in the meager light filtering through the grimy window. There's a collection of lancets, small, wickedly sharp blades, some straight, some curved, all designed for one purpose: to open a vein. There are fleams, hinged blades, used with a small hammer to make a quick, deep cut, and scarificators, spring-loaded devices with multiple blades that can make several small incisions at once. He selects a lancet, testing its edge with his thumb, a gesture that sends a cold shiver down your spine that has nothing to do with your fever. He approaches your bed, his movements practiced, almost ritualistic. He ties a linen strip, tight and unyielding, around your upper arm, just above the elbow. You feel the pressure, the uncomfortable constriction, and then, slowly, you watch as the veins in your forearm begin to bulge, dark blue rivers beneath your skin. Your heart pounds, a frantic drum against your ribs, not just from the fever, but from an instinctual dread. You know what's coming. You've heard the stories, seen the aftermath. He takes your hand, his grip firm, and positions your arm. You try to pull away, a feeble protest, but his strength is undeniable. He presses his thumb against a prominent vein, making it stand out even more. Then, with a swift, practiced motion, the lancet descends. You feel a searing, sharp pain, a sudden, shocking prick that makes you cry out, a sound that is quickly swallowed by the oppressive silence of the room. A bead of dark, viscous blood wells up, then a trickle, then a steady stream. It's warm, impossibly warm, as it flows over your skin, down your arm, and into the waiting basin he holds beneath. The basin is made of pewter, perhaps, or a simple wooden bowl. You watch, morbidly fascinated and horrified, as your life force, the very fluid that courses through your body, drains away. The blood is a deep, unsettling crimson, almost black in the dim light, and it pools in the basin, slowly, relentlessly. The barber surgeon is meticulous, watching the flow, occasionally stirring the blood with a finger, examining its texture, its color, convinced he's gleaning vital information about your condition. He might even hold it up to the light, muttering about the plethora or the bad humors he's now extracting. As the minutes tick by, the initial shock gives way to a growing weakness. Your head spins, not just from the fever, but from the loss of blood. The room starts to tilt, the edges of your vision blurring. Your breath becomes shallower, your heart a frantic flutter. You feel cold now, a profound, bone-deep cold that seeps into your very core. The pain in your chest, the throbbing in your head, they haven't gone away. If anything, they feel sharper, more acute, as if your body is protesting this violent extraction. He continues to drain, sometimes for what feels like an eternity, sometimes for a prescribed amount, a pint, 2 pints, sometimes even more. In an adult, losing a pint of blood is significant. Losing 2 or 3 can be life-threatening. Yet, the belief persists that more is better, that the bad blood must be purged entirely. You feel yourself slipping, consciousness flickering like a dying candle. The voices around you, if there are any, become distant, muffled. The world narrows to the dull ache in your arm, the rhythmic drip of your blood, and the overwhelming sensation of emptiness. And this isn't the only method. Perhaps the barber surgeon decides on cupping. Imagine heated glass or horn cups, their rims slick with grease, pressed against your skin. The air inside cools, creating a vacuum that sucks your flesh upwards, creating grotesque red welts. Sometimes, before applying the cups, he might scarify the skin first, making tiny incisions so that the cupping can draw out even more blood. The sensation is a strange mix of pressure and burning, followed by the sight of your skin being pulled into a distended, purplish dome. It's not just uncomfortable, it's genuinely painful, leaving angry, bruised marks that will linger for days, if not weeks. Or, perhaps, you're offered the gentler approach, leeches. Imagine the sight of a small glass jar filled with dark, writhing creatures, their segmented bodies undulating in the murky water. The barber surgeon carefully selects a handful, perhaps 3 or 4, and applies them directly to your skin, on your chest, behind your ears, or even on your eyelids, depending on the ailment. You feel a strange, cold, slimy sensation as they attach, their suckers gripping your flesh. Then, a tiny, almost imperceptible prick as they bite. injecting an anticoagulant and an anesthetic, making the process surprisingly painless at first. But then, the horror truly sets in. You watch as these repulsive creatures engorge themselves, slowly swelling with your blood, transforming from thin, dark worms into fat, pulsating sacs. They might feed for hours, leaving behind small, triangular wounds that continue to ooze blood long after they've detached or been forcibly removed. The thought of these parasites feeding on your vital fluid, growing bloated with your life, is a special kind of revulsion. The immediate aftermath of any of these procedures is often one of extreme weakness. You might faint, or simply lie there, too exhausted to move, too light-headed to think clearly. Your family, watching on, might express hope, seeing your pallor as a sign that the bad humors have been expelled. They might believe that this profound weakness is the body cleansing itself, a necessary step on the road to recovery. But the reality, you quickly discover, is often far different. The open wounds, whether from a lancet, a scarificator, or a leech, are prime entry points for infection. In an era before antiseptics and antibiotics, a simple cut could become a death sentence. You might develop a raging infection, the wound turning red, swollen, weeping pus, the fever returning with a vengeance, higher and more relentless than before. Or, the extreme blood loss could simply push your already weakened body past its breaking point. You might become severely anemic, your heart struggling to pump the remaining thin blood, your organs starved of oxygen. Your recovery, if it comes at all, is slow, arduous, and fraught with the constant threat of relapse or secondary complications. Think about that for a moment. Imagine waking up today with a flu, a bad cough, or even a broken bone. You'd expect a doctor, clean instruments, perhaps medication. Certainly not someone coming at you with a sharp blade to drain your blood. The sheer terror, the lack of alternatives, the casual acceptance of such brutality as a cure is what truly sets this historical experience apart. You're not just fighting the disease, you're fighting the treatment itself. A treatment that often proves to be the more formidable and ultimately fatal adversary. This wasn't a last resort. It was often the first resort, a testament to a medical understanding that, while well-intentioned, was tragically misguided and incredibly dangerous. Imagine a persistent, mind-numbing headache, not just a dull throb, but a pressure behind your eyes that feels like your skull is too small for your brain. A relentless pounding that echoes with every heartbeat. Perhaps you've suffered a head injury, a blow that left you dazed, disoriented, and now plagued by seizures or strange, erratic behaviors. Or maybe, in this ancient world, you're simply prone to fits of madness, your mind a swirling tempest of voices and visions that no one understands. In an age without neurology or psychology, such afflictions are often attributed to evil spirits, demons trapped within your very skull, or an imbalance of humors causing vapors to rise to your brain. And the solution, ancient and terrifying, is trepanation. This isn't a modern neurosurgical procedure performed in a sterile operating room with advanced imaging and precision instruments. No, this is a raw, brutal act, often performed by a shaman, a tribal elder, or a local healer with rudimentary tools and a profound belief in its efficacy. You're not being prepped for surgery. You're being held down, perhaps by strong hands, perhaps by leather straps. your head shaved roughly, the coarse hair falling onto the dirt floor around you. The setting is stark, primal. It might be a cave, a hut, or an open clearing under the harsh sun. The air is thick with the smell of wood smoke, damp earth, and the metallic temps of fear. You can hear the distant sounds of village life, children playing, animals lowing, a stark contrast to the grim, focused silence of the people gathered around you, their faces etched with a mixture of concern and morbid fascination. You are the spectacle, the patient, the one upon whom this ancient, sacred, and terrifying ritual is about to be performed. The healer approaches, his face impassive, his hands calloused and steady. In his grip, he holds the instruments. Forget scalpels and drills. These are tools of stone, bone, or crude metal. A sharp flint knife, perhaps, for cutting through the scalp. A scraper, made of obsidian or sharpened bone, designed to abrade the bone. And then, the trepanation tool itself, a rough, hand-cranked drill with a stone bit, or a simple, sharp-edged chisel and a small mallet. The sight of these implements, cold and unyielding, sends a fresh wave of terror through you. You feel a primal urge to flee, to scream, but your body is held fast, paralyzed by a combination of fear and the crude restraints. The first step is to prepare the site. The healer might rub a poultice of herbs onto your scalp, perhaps for pain, perhaps for ritualistic purposes. Then, the flint knife comes down. You feel a sharp, searing pain as the blade slices through your skin, cutting away a circular piece of scalp, exposing the bone beneath. The warm, sticky gush of blood runs down your face, into your hair, an immediate, visceral reminder of the violation your body is undergoing. You might cry out, thrash against your restraints, but the hands holding you are unyielding. Now comes the truly harrowing part, the bone itself. The healer takes up the scraping tool, or perhaps the chisel and mallet. You feel a dull, grinding pressure against your skull, followed by a sickening sound, the scrape of stone against bone, the dull thud of mallet on chisel. With each stroke, each deliberate movement, a tiny amount of bone dust is created, falling onto your face, mixing with the blood. This isn't quick. It's a slow, arduous process, a painstaking excavation. Imagine the sensation, the continuous vibration against your skull, the pressure, the sound of your own bone being slowly, methodically removed. It's a sound and a feeling that will haunt your nightmares, if you survive. If a drill is used, the process is different, but no less terrifying. You hear the rhythmic worry, the grinding sound, feel the intense pressure as the stone bit bites into your skull. The healer works slowly, carefully, constantly checking the depth, fearful of going too far. The air fills with the faint, acrid smell of burning bone and blood. You are acutely aware of the thin barrier that separates the drill from your brain, the very seat of your consciousness. Every minute feels like an hour. Every scrape, every rotation of the drill, a step closer to an unknown fate. The goal, of course, is to create a hole, a window into your skull. The belief is that this opening will allow the evil spirits to escape, or release the pressure that causes your headaches, or allow the bad humors to drain. You might see the healer pause, wipe away blood, examine the exposed bone with intense concentration. He might murmur incantations, prayers to ancient gods, hoping to guide his hand. to ensure a successful outcome. Finally, after what feels like an eternity of agony and dread, the bone gives way. There's a sudden, sickening pop or a final, grinding scrape as the last sliver of bone is removed. You feel a strange, immediate release of pressure, perhaps, or a sudden, dizzying wave of lightheadedness. Now, instead of solid bone, there is an open hole in your skull, a raw, exposed window to your brain, covered only by the thin membrane of the dura mater. You might even feel a faint pulsation beneath the opening, the rhythm of your own brain beating just beneath your fingertips. If you were able to touch it, the healer then cleans the wound, perhaps with water, perhaps with more herbal concoctions. There's no sterile dressing, no antibiotics. A simple poultice of leaves or moss might be placed over the gaping hole, and then a bandage, often just a strip of cloth, is tied around your head to hold it in place. You are left weakened and traumatized to recover. The immediate risks are catastrophic. Infection is almost guaranteed. Imagine bacteria, dust, and debris from the crude tools and unhygienic environment entering directly into your brain. You might develop meningitis, a raging infection of the membranes surrounding your brain and spinal cord, leading to excruciating pain, further seizures, high fever, and often death. Or a brain abscess, a pocket of pus forming directly within your brain tissue, causing irreversible damage, paralysis, or a slow, agonizing demise. There's also the risk of hemorrhage. The healer, no matter how skilled, is working blindly, without knowledge of the delicate blood vessels that crisscross the skull and brain. A slip of the hand, a moment of carelessness, and a major artery or vein could be severed, leading to massive, uncontrollable bleeding inside your skull, compressing your brain and causing rapid death, even if you survive the immediate bleeding. The damage to brain tissue itself from the crude instruments could be permanent, leaving you paralyzed, mentally impaired, or in a persistent vegetative state. And even if, by some miracle, you survive the procedure and avoid immediate infection or hemorrhage, you are left with a gaping, unhealed hole in your skull. This leaves your brain vulnerable to further injury, to subsequent infections, and to the constant threat of pressure changes. The long-term prognosis is grim, even for those who recover. Yet, archaeological evidence suggests that some individuals survived trepanation, living for years, even decades, with the telltale hole in their skull. This speaks to the incredible resilience of the human body, but also to the sheer luck involved. For every survivor, there were undoubtedly many more who succumbed to the procedure itself, or to its horrific complications. Think about the sheer, unadulterated terror of this. You're not just facing a medical procedure. You're facing a primitive, brutal assault on the very core of your being, your consciousness. The thought of someone drilling into your skull, without anesthesia, without sterile conditions to cure you, is a stark reminder of the desperate measures people took in the face of suffering, and the terrifying line between hope and fatal intervention in the ancient world. You are utterly at the mercy of a belief system and a set of tools that could just as easily release your soul from your body as they could release an evil spirit. You've developed a persistent, agonizing rash, a collection of pustules and sores that refuse to heal, spreading across your body in a grotesque tapestry. Perhaps your hair is falling out in clumps. Your joints ache with a deep, bone-weary pain, and a constant, debilitating malaise saps your strength. You might be suffering from syphilis, a devastating sexually transmitted infection that in this era, before penicillin, was a terrifying, often fatal, scourge. Or perhaps you have another ailment, a skin condition, or even just a general malaise that has baffled other remedies in this time. The late medieval to early modern period, the answer, the miracle cure for a host of intractable diseases, often came in the form of a shimmering liquid metal, mercury. Yes, the same mercury that we now understand to be a potent neurotoxin, capable of causing devastating long-term damage and death. But then it was hailed as a powerful purgative, a substance believed to cleanse the body of impurities, to drive out the bad humors and poisons that caused illness. Imagine yourself in a physician's chambers, a room that, despite its attempts at learned decorum, still carries the faint, cloying scent of strange chemicals and human suffering. The physician, a man of serious demeanor, examines your sores with a critical eye. He nods, a pronouncement of certainty in his voice. The foul humors, he declares, they must be purged. We shall use quicksilver. Your heart sinks, for you've heard the stories, the hushed whispers of those who underwent the mercury cure. It's a treatment as dreaded as the disease itself, a journey into a hellish landscape of pain and degradation. The mercury treatment could take several forms, each more horrifying than the last. One common method was an external application, mercury ointments. Imagine a thick, greasy paste, smelling faintly metallic and acrid, being rubbed vigorously into your skin. Day after day, you would endure this ritual, the mercury slowly absorbing through your pores, entering your bloodstream. Your skin, already irritated by the disease, would become inflamed, angry, developing a strange, silvery sheen in places. The itching would be unbearable, a constant torment that no scratching could alleviate. But the real horror began as the mercury started to take hold internally. You'd first notice a strange, metallic taste in your mouth, persistent and unpleasant. Then your gums would begin to swell, becoming tender and inflamed, bleeding at the slightest touch. Your teeth, once firm, would loosen, feeling as though they were about to fall out. And the salivation, oh, the salivation. Your mouth would produce an incessant, overwhelming flow of saliva, sometimes a liter or more a day, drooling uncontrollably, soaking your clothes, forcing you to carry a spittoon at all times. This excessive drooling, known as tyolism, was actually considered a sign that the mercury was working, that the poisons were being expelled. The more you salivated, the more the physician would declare success. Even as you drowned in your own bodily fluids, the smell, too, was unbearable. Your breath would acquire a putrid, metallic odor, so foul that those around you would recoil. Your teeth, if they hadn't already fallen out, would turn black, corroding in your mouth. Your tongue would swell, becoming so large and painful that eating and speaking would become a torment. You might develop painful ulcers and lesions inside your mouth and throat, making every swallow an agonizing ordeal. The pain would be constant, a burning, gnawing ache that never truly subsided. Beyond the mouth, the mercury would wreak havoc throughout your entire body. You would experience severe gastrointestinal distress, intense abdominal cramps, relentless nausea, and violent diarrhea, often bloody. Your kidneys, struggling to filter the toxic metal, would begin to fail, leading to swelling, fluid retention, and further poisoning. Your hands and feet might develop tremors, an uncontrollable shaking that would make even simple tasks impossible. This neurological damage, known as erethism, would progress to include irritability, shyness, memory loss, and ultimately severe psychological disturbances, hallucinations, paranoia, and outright madness. You would literally be driven insane by the very cure meant to save you. Another method of mercury administration was through fumigation. Imagine being placed in a small, enclosed box or tent, with only your head protruding. Below you, a brazier of hot coals, onto which mercury sulfide cinnabar would be sprinkled. The mercury would vaporize, and you would inhale the toxic fumes, breathing them directly into your lungs. The air inside the box would become heavy, acrid, and suffocating. You would cough, choke, your lungs burning with every breath, your eyes watering uncontrollably. The heat would be intense, the confinement claustrophobic, and the knowledge that you were deliberately inhaling a known poison would be a special kind of hell. This process, repeated over days or weeks, would accelerate the onset of systemic mercury poisoning, driving the quicksilver deep into your tissues and organs. Then there was oral administration. Pills, powders, or liquids containing mercury compounds would be forced down your throat. Imagine the chalky, metallic taste, the immediate nausea, the burning sensation as it entered your stomach. These oral doses would often lead to rapid and severe gastrointestinal symptoms, exacerbating the diarrhea and vomiting, further dehydrating an already weakened body. The treatment was often prolonged, lasting for weeks, sometimes months, as physicians believed that only a sustained assault could truly cure the disease. During this time, your body would waste away. You would lose weight dramatically, your muscles atrophying, your skin becoming sallow and thin. The constant pain, the inability to eat properly, the relentless salivation, the tremors, and the growing madness would reduce you to a shadow of your former self. Your friends and family might visit, their faces a mixture of pity and fear, witnessing your slow, agonizing decline. They would see not a person recovering, but a person being systematically destroyed. Many patients did not survive the mercury cure. They would succumb to kidney failure, to overwhelming dehydration and electrolyte imbalance from the constant vomiting and diarrhea, to severe infections in their ravaged mouths, or simply to the cumulative, devastating effects of mercury poisoning on their vital organs and nervous system. Even those who recovered were often left with permanent damage, missing teeth, chronic neurological problems, tremors, mental instability, and a body scarred by the ordeal. The irony, of course, is that mercury did have some effect on syphilis. It could slow the progression of the disease in some cases, offering a glimmer of false hope. But the cost was immense, often exchanging one slow, agonizing death for another, or a life of chronic suffering. So, when you next brush your teeth or enjoy a meal without metallic tasting saliva flooding your mouth, consider the plight of those who sought relief from their suffering, only to be subjected to a cure that promised salvation but delivered a slow, torturous descent into madness and death, all thanks to the shimmering, seductive, and utterly toxic embrace of quicksilver. You would live or die, knowing that the very substance meant to heal you was slowly, deliberately, poisoning you from the inside out, You're suffering from a persistent cough, a shortness of breath that leaves you gasping for air, or perhaps a debilitating stomach ailment that wastes your body away. The conventional remedies have failed, and desperation gnaws at you. In this era, spanning from the medieval period well into the 18th century, a peculiar and deeply unsettling branch of medicine flourished: corpse medicine. Yes, you heard that right. The belief was that the human body itself, or parts of it, held potent curative powers, especially if the person had died a violent death. Their vital essence somehow preserved. Imagine yourself in the dark, wood-paneled study of a learned physician, the air thick with the smell of old books, dried herbs, and something else, something faintly earthy and unsettling. He listens intently to your symptoms, his brow furrowed in concentration. Then he turns to a cabinet, unlocks it with a heavy brass key, and reveals a collection of jars and pouches. Your eyes widen in a mixture of horror and morbid curiosity as he explains the proposed remedy: mumia. Mumia wasn't just ancient Egyptian mummies, though those were certainly ground up and consumed. It also referred to the dried and powdered flesh, bones, and blood of recently deceased humans. The more violent the death, the better, as it was believed that the vital spirit of the person remained potent within their remains. Imagine the concept. You are about to ingest the powdered remains of another human being, a person who might have been executed or died tragically, their body harvested for its perceived medicinal properties. The physician carefully measures out a small amount of dark, crumbly powder from a pouch. It's a grayish-brown, with flecks of bone and hair, smelling faintly of dust and something vaguely organic, something that reminds you of a burial plot. He mixes it with wine, or perhaps a bitter herbal concoction, and presents it to you. You stare at the goblet, the murky liquid swirling with the pulverized remnants of a stranger. Your stomach churns, a wave of nausea washing over you. Every instinct screams against this act, this cannibalistic consumption. But the physician assures you, with grave authority, that this is a proven remedy, a powerful cure for your ailments. Your desperation, the fear of your own lingering death, might just override your revulsion. You lift the goblet to your lips. The taste is foul, earthy, metallic, and utterly sickening. You feel the gritty texture of bone fragments, the faint stickiness of dried blood, the indescribable taste of human decay. You force it down, your throat constricting, your body rebelling with every swallow. The act itself is a profound violation, not just of your senses, but of a deeply ingrained taboo. You've consumed human flesh, not out of starvation, but out of a desperate, terrifying hope for healing. But mumia was just one aspect of corpse medicine. Another particularly gruesome remedy involved the use of cranial moss, or Usnea cranihumani. This was the moss, or lichen, that sometimes grew on the skulls of long-dead bodies, often those left exposed to the elements, such as criminals hanged and left on gibbets. It was believed to hold special properties, particularly for epilepsy, nosebleeds, and other head-related ailments, because of its direct association with the human head. Imagine the process of obtaining this medicine. Or someone on your behalf would venture to a gibbet, a place of public execution and decay, where the bodies of hanged criminals would slowly rot. The air would be thick with the stench of death, decomposition, and the grim reminder of human mortality. You would climb the scaffold, or reach up to the decaying skull and carefully scrape away the green, velvety moss that clung to the bone. The sight, the smell, the tactile sensation of touching a dead man's skull, still perhaps with remnants of hair or skin, is enough to induce vomiting. It's a macabre scavenger hunt for a supposed cure. Once collected, the moss would be dried and then, like the mumia, powdered and mixed with a liquid for consumption. Imagine drinking a potion infused with the very essence of decay, a substance that grew on the exposed skull of a criminal, absorbing the grim energies of death and suffering. The taste would be earthy, musty, and undoubtedly unsettling, a constant reminder of its gruesome origin. Other parts of the human body were also utilized. Human fat, particularly from executed criminals, was rendered down and used as an ointment for wounds believed to have healing properties. Human blood, especially fresh blood from a violently deceased individual, was sometimes drunk immediately, considered a powerful restorative. Even the urine of healthy individuals was sometimes consumed, believed to cleanse the system, though this practice was more about internal purification than consuming the dead. The efficacy of these treatments, as you can imagine, was precisely zero. Ingesting mumia, which was often poorly preserved and sometimes even faked with animal parts, could introduce pathogens, bacteria, and parasites into your already compromised system. You could contract food poisoning, dysentery, or other infections, exacerbating your original illness and pushing you closer to death. Consuming the moss from a decaying skull could similarly introduce mold, fungi, and bacteria, leading to respiratory infections or other complications. The psychological toll alone, the sheer revulsion and guilt of engaging in such practices, must have been immense. The belief system behind corpse medicine was complex. It stemmed from ancient traditions of sympathetic magic, where like treated like, and from the idea that the vital spirit of a person, especially one who died violently and thus had not had their spirit fully escape, could be transferred to the living. It was also intertwined with the rise of anatomical studies, where the human body was increasingly seen as a source of knowledge, and perhaps power. However, for you, the patient, this was not a matter of philosophical debate. This was a desperate gamble, a last resort in the face of an incurable disease. You would swallow the powdered dead or scrape the moss from a skull, not out of a belief in cannibalism, but out of a desperate, primal urge to survive. You would endure the foul taste, the psychological horror, the physical revulsion, all in the faint hope that this unspeakable remedy might somehow, miraculously, save your life. But more often than not, it would merely add another layer of suffering, another vector for disease, another step on the grim path to an early grave. The irony is bitter. In your desperate attempt to cling to life, you were forced to consume death, and in doing so, often hastened your own. You would carry the memory of that taste, that smell, that profound violation until your dying breath, a chilling testament to the strange and brutal landscape of historical medicine. You've been struggling. Your mind is a tempest, a whirlwind of anxieties, obsessions, or voices that whisper relentless torments. Perhaps you suffer from severe depression, a black cloud that smothers all joy, or crippling schizophrenia, where reality itself seems to unravel. In the early to mid-20th century, before the advent of modern psychotropic medications, Mental illness was a profound mystery, often met with fear, stigma, and desperate, sometimes barbaric interventions. You've been institutionalized, perhaps against your will, in a place that promises treatment but often delivers only confinement and despair. Imagine the sterile, yet somehow chilling, environment of an asylum or hospital ward. The air is thick with the smell of antiseptic, but also something else, the faint, unsettling odor of fear, of desperation, of lives lived on the edge of sanity. You've been deemed unmanageable, violent, or simply incurable by conventional means. And so, the doctors propose a radical new procedure, one that promises to quiet the storm in your mind, to bring peace to your troubled soul, a lobotomy. This isn't the later, more refined prefrontal lobotomy, but its earlier, cruder, and perhaps even more terrifying predecessors. The theory, simplistic and deeply flawed, was that by severing certain connections in the frontal lobes of the brain, the seat of complex thought and emotion, the distressing symptoms of mental illness could be alleviated. It was a desperate gamble, born of a profound lack of understanding of the brain's intricate workings. You're led into a small, clinical room, the walls painted a stark, sterile white. The doctor, a man of science and conviction, explains the procedure in detached, clinical terms, using words you barely comprehend, words like leucotomy and psychosurgery. You're given a sedative, perhaps, but it's not enough to fully dull the edges of your terror, only to make you feel heavy, disconnected, a spectator in your own impending nightmare. One of the earliest forms, the Egas Maniz technique, involved drilling holes into the sides of the skull. Imagine the sound of the drill, a high-pitched whine, the sensation of intense pressure against your head as the bone is penetrated. You might feel a dull ache, a profound vibration that seems to shake your very being. Through these holes, a specialized instrument called a leucotom, essentially a thin, retractable wire loop, would be inserted. The wire would then be extended and rotated, blindly sweeping through the brain tissue, severing connections in the frontal lobes. You wouldn't see it, but you would feel the pressure, the sickening sensation of something being moved, torn, deep within your skull. The sound, if you were conscious enough to hear it, would be a soft, squelching noise, an internal tearing that would haunt you. But perhaps the most infamous and truly terrifying variation was the transorbital lobotomy, popularized by Walter Freeman. This procedure was so quick, so simple, that it could be performed in an outpatient clinic, sometimes even in a doctor's office. You wouldn't be taken to an operating room. You might just be seated in a chair or lying on a gurney, in a room that feels far too casual for what is about to happen. Not with a scalpel, but with a tool that resembles an ice pick or an ordinary kitchen knife. He holds it with an unsettling familiarity. You're given an electric shock, an electroconvulsive therapy, ECT treatment, to induce a seizure and render you unconscious for a brief period. Imagine the jolt, the sudden, violent convulsions, the darkness that swallows you whole when you begin to regain consciousness. Or perhaps as you are still in the twilight of the induced seizure, the real horror begins. The doctor lifts your eyelid. He places the tip of the ice pick instrument against the thin bone of your eye socket, just above the eyeball. You feel a sudden, intense pressure, a sickening crunch as the instrument is hammered through the delicate bone. Imagine the sound, the feeling of something sharp penetrating the soft tissues around your eye, then boring directly into your brain. There's no precision here, no visual guidance, just the brute force of a hammer striking steel. The doctor then wiggles the instrument, sweeping it back and forth, severing the neural connections in your frontal lobes. You might feel a profound, disorienting pressure, a tearing sensation, a deep internal violation that is beyond words. There might be a spray of blood, a trickle down your face as the instrument is withdrawn. Then the process is repeated on the other eye. 2 holes, 2 brutal penetrations into the very core of your being, all performed with a casualness that is utterly chilling. The immediate aftermath is often one of profound disorientation. You might wake up confused, groggy, with a dull ache behind your eyes, and a strange, unsettling emptiness in your mind. Your personality, your very essence, might be irrevocably altered. Some patients became docile, quiet, their previously troubling symptoms seemingly gone, but often this came at a terrible cost. They lost their spark, their spontaneity, their ability to feel deep emotions. They became blank slates, emotionally flat, childlike, or simply vegetative. They might be unable to care for themselves, losing their independence and becoming a burden on their families. The risks were immense. Hemorrhage within the brain was a constant threat, leading to strokes, paralysis, or immediate death. Infection, despite the use of antiseptics, was still a possibility, leading to meningitis or brain abscesses. Brain damage, often severe and irreversible, was almost a certainty. Patients could suffer seizures, permanent cognitive deficits, or even die from the direct trauma to the brain. For many, the cure was a fate worse than death, transforming them into living ghosts, their minds hollowed out, their personalities erased. Think about the profound violation of this procedure. Your brain, the seat of your thoughts, your memories, your identity, is brutally assaulted with a crude instrument, without your full consent, without a true understanding of the consequences. You are left not cured, but fundamentally changed, a stranger in your own body. Your potential for joy, for sorrow, for complex human experience, irrevocably diminished. The ice pick lobotomy, a testament to the desperate, often misguided, attempts to control and fix the human mind, stands as a chilling reminder of a time when the search for a cure could lead to the ultimate destruction of the self. You survived, perhaps, but at what cost? You were a walking monument to a medical horror, a testament to the fact that sometimes the cure truly was a more terrifying and permanent affliction than the disease itself. You're feeling a bit sluggish, perhaps a persistent ache in your joints, or a general sense of fatigue that modern life seems to inflict. Maybe you're worried about your virility, or simply seeking a boost to your overall health and vitality. It's the early 20th century, an age of rapid scientific discovery, and the public is captivated by the wonders of new technologies. One of the most intriguing and mysterious discoveries is radioactivity, particularly radium. It glows in the dark, promises boundless energy, and is hailed as a miracle element, a force of nature that can invigorate and heal. Imagine stepping into a bustling pharmacy, or perhaps receiving a glossy advertisement in the mail. The claims are bold, almost unbelievable. Radium water for health. Cure all ailments with the power of the atom. Restore youthful vigor. The advertisements feature testimonials from seemingly robust individuals, promising relief from everything from arthritis and gout to impotence and general debility. This is the era of patent medicines, unregulated concoctions that promise the moon and deliver anything from harmless sugar water to deadly poisons. And among the most insidious are those laced with radium. You buy a bottle of Radithor, or perhaps a radiondocrinator device, a small radium-infused pad to wear against your skin. The idea is simple. The subtle radiation will stimulate your glands, cleanse your blood, and flood your body with renewed energy. It sounds so scientific, so modern, so full of promise. You open the bottle of radium water. It's tasteless, odorless, perhaps even faintly glowing in the dark, adding to its mystique. You drink it day after day, week after week, convinced that you are doing something good for your body, that you are investing in your future health. At first, you might even feel a surge of energy, a subtle uplift. This could be a placebo effect, or perhaps the initial temporary stimulation that small doses of radiation can sometimes induce. You tell your friends, your family, about this amazing new discovery. You are a pioneer, embracing the future of medicine. But then, slowly, subtly, the insidious effects begin. You might notice a persistent, dull ache in your bones, a tiredness that creeps in despite your treatment. Your teeth might begin to ache, becoming sensitive, perhaps loosening slightly. Your gums might become inflamed, bleeding easily. You might experience persistent headaches, nausea, or a loss of appetite. These are the early warning signs, but they are often dismissed, attributed to your original ailment, or simply ignored in the fervent belief that the radium is working its magic, purging your system as you continue to consume the radium water, or expose yourself to the radium-infused pads. The damage progresses. Radium, being chemically similar to calcium, is absorbed by your bones. It doesn't pass through your body. It lodges itself there, radiating constantly, day and night, year after year. Imagine your bones, the very framework of your body, slowly becoming radioactive. The alpha particles emitted by the radium bombard the surrounding bone marrow and tissue, destroying cells, causing mutations, and slowly turning your skeleton into a radioactive time bomb. You might develop severe anemia, as your bone marrow, responsible for producing blood cells, is slowly destroyed. You become pale, weak, constantly fatigued, breathless at the slightest exertion. Your immune system weakens, leaving you vulnerable to infections. Your teeth, if they haven't already fallen out, become brittle, breaking easily. Your jawbone, in particular, becomes a target, leading to a horrifying condition known as radium jaw, a necrosis of the jawbone, where the bone literally rots away, causing excruciating pain, disfigurement, and often deadly infection. Imagine your jawbone crumbling, your teeth falling out, your mouth a festering wound, all while you continue to drink the very substance causing your demise. The bone pain becomes excruciating, a deep, persistent ache that radiates through your entire skeleton. You might develop spontaneous fractures, your bones becoming brittle and weak from the constant radiation. The calcium in your bones, leached out by the radium, can lead to painful calcium deposits in your joints and soft tissues. You become a shell of your former self, emaciated, in constant agony. Your body slowly disintegrating from the inside out, and then there's the cancer. The constant radiation to your bones, your blood-forming tissues, and your organs dramatically increases your risk of developing various cancers. Bone sarcomas, a particularly aggressive form of bone cancer, become a terrifying reality. Leukemia, a cancer of the blood, can develop from the damage to your bone marrow. Tumors can appear in your soft tissues, your stomach, your liver, wherever the radium's deadly particles have wreaked havoc, perhaps. The most tragic and well-documented case is that of Eben Byers, a wealthy American industrialist and amateur golfer who consumed vast quantities of Radithor, believing it was enhancing his health and virility. He enthusiastically endorsed the product, even sending it to friends. Over several years, he drank an estimated 1,400 bottles of radium water. By the time he realized something was terribly wrong, it was too late. His teeth fell out. He developed multiple abscesses in his mouth. His jawbone began to disintegrate, and holes formed in his skull. He suffered excruciating pain, losing most of his upper jaw and much of his lower jaw. By the time he died in 1932, his body was a radioactive wreck, his organs and bones ravaged by the very cure he had so eagerly embraced. The cause of death was officially listed as radium poisoning. The radium craze eventually faded as the horrific truth became undeniable, leading to greater regulation of patent medicines. But for those who succumbed, it was a slow, agonizing, and truly insidious death. You were not just poisoned, you were irradiated, your body becoming a source of deadly energy, destroying itself from within. You drank the glowing water, believing it was life-giving, only to find it was a slow-acting poison, a radiant killer that promised vitality but delivered a prolonged, excruciating demise, leaving you a radioactive ghost of your former self. A chilling testament to the dangers of scientific ignorance and unchecked commercial greed. You're suffering from a persistent cough, a hacking, chest-rattling affliction that keeps you awake at night and leaves you breathless during the day. Perhaps you're plagued by a nagging headache or a general sense of unease and anxiety that the pressures of Victorian life seem to exacerbate. Or maybe you simply need a pick-me-up, a boost of energy to get through the long, demanding hours of work. It's the late 19th and early 20th centuries, an era of burgeoning pharmaceutical industries, but one where the understanding of addiction and the long-term effects of powerful drugs is woefully inadequate, if not entirely absent. Imagine walking into a chemist shop, a reputable establishment with polished wood and gleaming glass bottles. You explain your symptoms to the chemist, a man in a starched white coat, who listens with a sympathetic ear. He reaches for a bottle, perhaps a brightly labeled concoction promising Dr. So-and-so's wonderful cough syrup, or Mrs. Winslow's soothing syrup. You trust him. He is an authority figure, a purveyor of health. What you don't know, and what he might not fully understand himself, is that these seemingly innocuous remedies are often packed with incredibly potent, highly addictive substances: opium, morphine, heroin, or cocaine. Let's start with heroin. Yes, the same heroin that is now a notorious illicit drug. But in the late 1800s, it was synthesized by Bayer and marketed as a non-addictive alternative to morphine, a powerful cough suppressant and a painkiller. Imagine being given a bottle of heroin cough syrup. It tastes sweet, perhaps a little bitter, but it immediately works wonders. Your cough subsides, your chest feels clearer, and a wave of blissful calm washes over you. The anxiety recedes, and you feel a profound sense of well-being, a warmth that spreads through your limbs. This is not just relief, it's euphoria. You continue to take the syrup, perhaps a teaspoon, whenever your cough returns, or whenever you feel that familiar ache or anxiety. The relief is so immediate, so profound, that you can't imagine living without it. You become reliant on it, not just for your physical symptoms, but for the comforting mental escape it provides. You're not thinking about addiction. You're thinking about feeling better, about finally finding a remedy that truly works. But slowly, insidiously, the addiction takes hold. You find you need more and more of the syrup to achieve the same effect. The cough, if it was ever truly there, becomes secondary. Now you're taking it to stave off the growing discomfort, the creeping anxiety, the profound malaise that sets in when you miss a dose. You experience withdrawal symptoms, intense cravings, sweating, chills, muscle aches, nausea, diarrhea, and an unbearable restlessness. Your body, your mind, screams for the drug. You are trapped, a prisoner to a cure that has become your master. Your life begins to unravel. You become lethargic, neglecting your responsibilities, your relationships. Your appearance deteriorates. You might suffer from constipation, dental problems, and a general decline in health due to poor nutrition and the drug's effects on your body. The initial euphoria is replaced by a desperate chase for relief, a constant struggle against the torment of withdrawal. You might try to stop, but the physical and psychological grip of heroin is relentless, a brutal cycle that few can break without intensive and often unavailable help. For many, this cough syrup became a lifelong, debilitating addiction, leading to premature death from overdose, malnutrition, or complications related to drug use. Now, consider cocaine. In the same era, cocaine was also widely available and openly marketed as a tonic, an energy booster, a cure for everything from fatigue and depression to hay fever and toothache. Imagine buying a bottle of coca wine or Mariani wine, a popular tonic endorsed by popes and presidents, boasting the invigorating properties of the coca leaf. Or perhaps you're given cocaine drops for a toothache, or a nasal spray for your persistent sniffles. You take a dose. Immediately, you feel a rush of energy, a surge of confidence. Your senses sharpen, your mind becomes clear, and you feel incredibly capable, even brilliant. Fatigue vanishes, replaced by a boundless enthusiasm. You are more productive, more articulate, more charming. This, you think, is the true elixir of life, the key to unlocking your full potential. But like heroin, the initial benefits quickly give way to a dark underside. You find yourself needing more and more to achieve that initial high. Your sleep patterns become erratic. Your appetite diminishes. You become irritable, anxious, even paranoid. Your heart races. Your blood pressure soars, putting immense strain on your cardiovascular system. The initial clarity of thought gives way to disorganized thinking, hallucinations, and delusions. You might experience cocaine bugs, the terrifying sensation of insects crawling under your skin, driving you to scratch and tear at your flesh. The physical toll is immense. nasal damage from snorting, heart problems from the constant strain, malnutrition, and a profound mental deterioration. You become a shadow of your former self, consumed by the relentless pursuit of the drug, living in a state of hyper-alertness and paranoia. The tonic that promised vitality has stolen your peace, your health, and your sanity. Overdoses, heart attacks, strokes, and drug-induced psychoses became common causes of death for those who embraced cocaine as a cure. The tragedy of these medicines lies in the profound ignorance of their true nature. They were prescribed and consumed with the best intentions, believing them to be benevolent remedies, when in fact they were powerful, addictive substances capable of destroying lives. You, the unsuspecting patient, sought relief from a minor ailment or a fleeting discomfort, only to find yourself ensnared in a chemical trap, a slave to a substance that promised freedom but delivered a slow, agonizing descent into addiction, mental illness, and often an early death. The very medicine meant to heal you became the most dangerous and inescapable disease of all, a chilling testament to the era's naivety and the lethal power of misunderstood pharmacology. You're feeling lethargic, depressed, or perhaps plagued by a mysterious chronic pain that doctors can't quite diagnose. It's the mid-19th to early 20th century, and electricity is a marvel, a new and exciting force of nature that promises to revolutionize everything, including medicine. The idea that electricity could recharge the body, stimulate nerves, and restore vitality gains traction, leading to the widespread adoption of galvanism or electrotherapy. Imagine walking into a physician's office, perhaps a spa, or even seeing advertisements for home electrotherapy kits. The air buzzes with an almost palpable excitement about this invisible force. The doctor, a man of scientific curiosity, explains that your body is a complex electrical system, and that by applying carefully controlled currents, your ailments can be shocked back into health. It sounds plausible, modern, and utterly fascinating. You're prepared for the treatment. You might be asked to sit in a specially designed chair or lie on a table. The doctor takes out his apparatus, a large, ornate machine with brass terminals, switches, and perhaps a crackling Ruhmkorff coil designed to generate high-voltage pulses from a battery. Wires, insulated with rubber or silk, lead to various electrodes. These electrodes, often simple metal plates or sponges soaked in saline, are applied directly to your skin. Imagine the sensation. The doctor moistens the electrodes and places them on different parts of your body, perhaps on your temples for a headache, your chest for heart palpitations, your limbs for muscle weakness, or even directly on your spine for neurological issues. You feel a strange tingling sensation, a prickle that intensifies as the current is increased. It's not necessarily painful at first, more like an unsettling vibration, a feeling of something alien coursing through your body. The doctor watches your reactions, adjusting the current, seeking the optimal level. You might feel your muscles contract involuntarily, a sudden jerk of your arm or leg. Your facial muscles might twitch, pulling your mouth into an involuntary grimace. Your heart might pound a frantic rhythm against your ribs as the electricity stimulates your nervous system. The smell of ozone, that faint metallic scent associated with electrical discharges, might fill the air. You are, quite literally, being shocked back to health. For some, the experience was genuinely terrifying. The currents used were often crude and poorly controlled. Imagine a sudden, uncontrolled surge of electricity coursing through your body. You might experience a violent muscle spasm, a convulsion that throws you from the chair. You might feel a searing burn on your skin where the electrodes were applied, a painful reminder of the raw power being directed into your body. The risks, often misunderstood or simply dismissed, were significant. If the current was too strong or applied incorrectly, it could cause serious damage. Cardiac arrest was a very real danger, especially if the current passed directly through the chest, disrupting the delicate electrical rhythm of the heart. You could suffer a heart attack, your heart simply stopping under the uncontrolled electrical assault. Neurological damage was another terrifying possibility. Strong currents applied to the head could induce seizures, brain damage, or even strokes. You might experience prolonged confusion, memory loss, or a persistent tremor. The very nervous system that the electricity was supposed to stimulate could be permanently damaged, leaving you with debilitating conditions. Burns were also common. If the electrodes were not properly moistened, or if the current was too concentrated, it could cause severe electrical burns to the skin, leaving behind painful, disfiguring wounds that were prone to infection in an era before modern wound care. Imagine the smell of burning flesh, the searing pain, the blistered skin, all in the name of a cure. Furthermore, the lack of understanding of underlying medical conditions meant that electrotherapy was often applied indiscriminately. A person with an undiagnosed heart condition, a neurological disorder, or even just a severe infection could be subjected to electrical shocks that would exacerbate their illness, accelerate their decline, or directly cause their death. The rise of quackery also meant that many electrotherapy devices were sold for home use, often with little to no instruction on proper application or safety. Imagine a desperate individual, alone in their home, attempting to cure themselves with a powerful electrical device, unaware of the dangers, risking electrocution, burns, or cardiac arrest with every application. The line between therapeutic stimulation and outright harm was incredibly thin and often crossed. While modern electroconvulsive therapy (ECT) is a highly controlled and effective treatment for severe depression, the early, unregulated forms of galvanism were a far cry from this. You, the patient, were a guinea pig in a grand, often dangerous, experiment, subjected to an invisible force that promised vitality but could just as easily deliver a fatal shock, a debilitating burn, or a catastrophic cardiac event. You sought a recharge for your body, a jolt of energy to banish your ailments, but instead you risked a permanent shutdown, a final lethal surge of power that would extinguish your life. The hum of the electrical machine, once a sound of hope, could quickly become the ominous prelude to your demise, a chilling testament to the era's fascination with science and its dangerous overreach. And there you have it, a journey through some of the stranger and often deadly medical treatments that our ancestors endured. From the ritualistic draining of your life's blood to the brutal penetration of your skull, the slow, agonizing poisoning of quicksilver, the unsettling consumption of human remains, the lobotomies that stole your very self, the radioactive elixirs that turned your bones into a death trap, and the medicines that bound you in chains of addiction. to the shocking embrace of electricity. Each segment paints a grim picture. It's a stark reminder of humanity's desperate struggle against suffering, and the often terrifying line between hope and harm. As you settle back into your modern comforts, perhaps with a newfound appreciation for sterile needles, antibiotics, and actual scientific understanding, remember the sheer courage, or perhaps the sheer desperation, of those who faced such